Imagine you're walking into your doctor's office for a routine checkup, feeling perfectly healthy. But within moments, your doctor spots something that you didn't even think twice about. Something simple, like how you brush your teeth, take care of your feet, or even keep your nails clean. You might be surprised to know that these small hygiene habits can actually reveal a lot about your overall health, and doctors can often tell right away when a senior hasn't been taking care of themselves properly. It's not just about brushing your teeth or washing your hands. It's about those little things we often overlook as we get older. Things that can have a big impact on your well-being. Today we're going to dive into 9 common hygiene mistakes that seniors make, and I bet number 5 will really shock you. Trust me, by the end of this video, you'll want to pay attention to every little detail of your daily routine. If this sounds interesting to you and you want to learn more about staying healthy as you age, don't forget to hit that like button and subscribe to my channel for more helpful tips. I'd also love to hear your thoughts. If you've ever noticed any hygiene habits affecting your health, feel free to share in the comments below. Let's keep the conversation going and make sure we all take better care of ourselves every day. As we grow older, things change. Our bodies, our minds, and even the way we approach the simplest of tasks. One of the most overlooked aspects of aging, though, is personal hygiene. It might seem like something so basic, almost too trivial to mention, but in reality, it's one of the first things that doctors notice when they see a senior for the first time. You walk into a doctor's office, sit down for your routine checkup, and while they may smile and ask you how you're doing, the truth is, they've already started evaluating your health in a way that you probably wouldn't expect. It's not just about the numbers on the scale or the results from a blood test. No, it's the little things, the things you might not even notice. And trust me, as we get older, these small oversights can actually say a lot about our health. I remember one time when I was talking to Dr. Monroe, a family doctor I've known for years. She was telling me how, during her years of practice, she could spot certain health concerns just by looking at her patients' hygiene habits. The way they walked in, how they looked after themselves, the condition of their skin, their teeth, their nails. These things told her more about a patient's overall well-being than you'd ever imagine. Dr. Monroe told me, "You'd be surprised how quickly you can spot someone who isn't taking care of themselves properly. It's almost as if your body's quietly screaming for help, but without a word." And it's true. Take something as simple as oral hygiene. We all know brushing our teeth is important, right? But let's think for a moment about how easily it's overlooked. It's easy to brush quickly in the morning, skip it at night, or not pay attention to the finer details. You might think you're doing a good job, but the reality is that as we age, our mouths dry out, and our gums and teeth are more vulnerable than we realize. I've seen people in their 70s or 80s walk into a dentist's office, and the first thing the dentist notices is the gum recession. The thing is, gum disease doesn't just affect your mouth. It can have far-reaching consequences. Research has linked poor oral health to serious conditions like heart disease, diabetes, and even stroke. And it's not just about brushing your teeth. It's about how you brush them, what kind of toothbrush you use, and how often you floss. A soft, bristled brush using gentle strokes and flossing daily can make all the difference in preventing gum disease or other complications down the road. But let's not stop there. Think about your feet for a moment. As we get older, our feet become more prone to problems. You might be thinking, "I wear shoes so my feet are fine." But that couldn't be further from the truth. Shoes, especially ones that don't allow your feet to breathe, trap moisture, creating the perfect environment for fungal infections like athlete's foot. Now, you might think athlete's foot is just a nuisance, but if left untreated, it can lead to more serious infections, especially in people with diabetes. A small, unnoticed cut or blister on the foot can easily get infected, leading to painful complications. I've seen cases where someone comes in for a checkup and their doctor notices that their feet are in bad shape. And it's not just a cosmetic issue, it's a health issue. One of the first things doctors recommend is regular foot care. Washing your feet thoroughly, drying them completely, checking for any cuts or sores, and moisturizing them to prevent dry skin. All of these steps are essential. And don't forget about the shoes you wear. Breathable, comfortable shoes can go a long way in preventing foot-related problems. Then there's the skin. The older we get, the thinner and more fragile our skin becomes. I can't tell you how many seniors I've spoken to who didn't realize that the soap they were using could be doing more harm than good. Hot water, harsh soaps, and overly fragranced lotions strip away the natural oils in your skin, leaving it dry and susceptible to irritation or infection. This isn't just about vanity. This is about protecting your skin, which is your body's first line of defense. When your skin becomes dry, cracked, or irritated, it makes it easier for bacteria to enter your system, potentially leading to serious infections. Simple adjustments like using milder, fragrance-free soaps and applying moisturizer right after a shower can keep your skin healthy and strong and keep those infections at bay. But here's the thing that really blew my mind when Dr. Monroe said it. She told me that many seniors overlook their nails. Yes, nails. It's easy to assume that nails are just cosmetic, something you trim when they get too long. But neglecting your nails can lead to more issues than you might think. Your nails are a breeding ground for bacteria, especially if they're long and unkempt. Dirt and germs can hide in the spaces under your nails, and if you're not careful, you might end up with an infection. And that's not even the worst part. Nail fungus is another common issue that affects many seniors, often without them even realizing it. The pain, the swelling, and the discomfort can all be avoided with a simple routine. Regular trimming, cleaning, and moisturizing your nails and cuticles. It's a small habit that goes a long way in preventing bigger problems. As you're listening to this, you might be thinking, well, that all sounds like common sense. And it is, but that's exactly why it's so easy to overlook. We get so caught up in our busy lives, or we assume that certain things don't matter anymore, that we forget how important it is to take care of the basics. It's easy to forget to floss your teeth at night. It's easy to skip moisturizing your skin when you're feeling lazy. It's easy to overlook your feet when you're not in pain. And it's easy to let your nails grow longer than they should. But those little things matter. They matter a lot. I know this because I've seen firsthand the consequences of not paying attention to these things. I've watched friends and family members experience issues that could have been prevented with a little more care and attention to their hygiene. And it's not just about looking good. It's about feeling good. It's about staying healthy. When you neglect these simple hygiene habits, you're giving your body a chance to break down faster than it should. You're inviting problems that can affect your mobility, your comfort, and even your life expectancy. I'm not saying you need to become obsessive about your hygiene, but there are a few basic things you can do to make a world of difference. It's about taking small steps every day to protect your body and in turn protect your future. It's about feeling better, looking better, and staying healthy for as long as possible. So if you're a senior or you care about one, it's time to start paying attention to these simple everyday habits. Don't wait for something serious to happen before you start taking your hygiene seriously. It's easy to overlook, but when you do, you're missing out on an opportunity to live a healthier, happier life. Your body is telling you everything it needs. Listen to it and take action now before it's too late. And if you're someone who thought these things didn't matter anymore, think again. These small habits are the ones that will help you maintain your independence, keep you healthy, and allow you to live your life with confidence. After all, your body deserves your best effort every day. As we wrap up, I want to remind you that it's never too late to start paying attention to these small but important habits. It's easy to take the basics for granted, but they really do play a huge role in how we age. Every step you take to care for your body, no matter how small, makes a difference in your overall health and well-being. From brushing your teeth properly to taking care of your feet and skin, it's these everyday choices that will help you live healthier and more comfortably as time goes on. So if you're a senior or caring for one, don't wait for a wake-up call. Start today with a simple change. Maybe it's flossing every night or giving your feet the attention they deserve. These are the kinds of habits that'll keep you moving, keep you smiling, and most importantly, keep you feeling good about yourself. Taking care of the basics isn't just about looking good. It's about protecting your future. Remember, you have the power to shape your health in ways you might not even realize. It's all about being consistent with the little things,